unfortunately, this is another thing that this administration neglected to the point where it's a crisis. And I've spoken to a number of folks in this room about how dramatic this impact is. Had we, a few years ago, put into place reforms that both management and the NJEA and labor could have agreed on, were ignored by this administration. I've spoken to, see some NJEA leaders here, that we together, that we could have come to the table and could have headed off this catastrophe. And now it's a real problem. And it's an extraordinarily expensive one to deal with. And it's going to be much more brutal and difficult. Because again, we get back to the fact, we have no breathing room. We already have a $4 billion structural deficit. Dumping another $500 million or so into health benefits, which is what it would take at least to make a dent, is a real problem. The next administration, again, whichever one it is, this is another steaming hot pile of deficit that they're going to have to deal with. And there's no easy answers. There were relatively easy answers a few years ago had we taken action. It's tragic that we didn't, but make no mistake about it, it's going to get harder before it gets easier. I don't want to be fatalistic, but I want to be realistic and be honest with you. We do need to deal with this, and I'm very interested to see what comes out of the task force and how we, in a bipartisan way, might be able to do some short-term things that can ameliorate the impact. But look, public health benefit system, it's in a death spiral. Pretty much everybody agrees with that. I used that term 4 years ago that was coming, and it's here. And I hate it that I get to say I told you so. But it was recognizable then, and it was avoidable then. Well, we're in it now, and I'm not sure there's a way to get out of it. It might be that we have to triage and help everyone transition to a private market. I'm not sure, but I'm interested in hearing what the task force comes up with, and I'm very interested in working with you and the task force members, both sides of the aisle.
Please give us a reason to be more encouraged.
Sorry.
No, I'm not. I'm gonna weigh in almost exactly the same way. This is an issue that many of us on the budget committee since day one, because it's an issue that's not going away. And I work for county government. When we sit with our people, the number just continues to grow, even in forecasting for years. So this will, if we are going to honestly create impact, so I don't think there's any one easy way. I think there has to be a two-pronged approach, right? We have to triage the bleeding at the local levels, which is going to require some funding, whether it's a loan forgiveness program, right? Like they did before, it's that they don't have to pay back, which will help the districts, help the towns, and help the counties, and it drops down some percentage points on the premium of the employee. But this is an extraordinary undertaking that is going to require a lot of courage if, in fact, and I underscore courage, and I capitalize it, and I italicize it, and I boldface it, and I do everything else, because the way that the system is set up is that, as you know, then all local levels have to go back and negotiate all of those things. That's where it begins to get super complicated. These costs are going up. My frustration too is that it's always a twofold conversation, the employee and the employer. No, we have to have the hospitals at the table here too. Why is it that you go to a hospital, you get a knee replacement, I go to mine, I get a knee replacement. They may have the best health grades, both the same. Yours was 60 and mine was 110. I mean, that's, fair-based pricing has to, everyone, in an effort to do cost containment in this space, everyone who is contributing to the cost of it, both in paying and creating the increases, is going to have to feel some pain. I don't know what other way of doing this. So it's got to be triaged immediately to help soften the blow, because November is when we're all already in the exchange, and so it's right up on us. Then there has to be a long-term approach with a real structural shift that allows for districts and for local municipalities. It was severely frustrating in the last budgets when we raised this. It was 2020. I'm conflating all my years now, but we did have money in the budget. And not only was I looking for a Band-Aid, but to do a little bit of both in all of that. State employees were buffered, and I'm happy for them, but it was very overwhelming to then walk into a building and see my sheriff's officers who do the same thing that the state trooper in some degree does, And they're looking at you like, why is the state employees benefits getting covered and I had to contribute twice as much as I was doing last year? And there has to be, look, when you're looking at everything, and this is the thing, I don't know, Declan, if you've had these discussions, and I joked with, this was not with the working group, but it was outside of it, or I might have shared it when you all came. You know, GLPs, we keep hearing that that's really a big driver here, that other states are looking to figure out ways where the user is contributing, where there's more accountability in those spaces. I said that these conversations are great, but I feel like we have these every 5 or 7 years. Something is always going to drive some new thing will always drive us. One day someone's going to create a cream that is